So the exciting thing about glaucoma as a field, which is why I love it, is there's so many different treatment options. There are treatments that we can do in the office with the patient, or there are treatments we can do in the operating room. To start with treatments in the office, I always tell my patients that we're a team. We're working together. We start patients on medications that lower their eye pressure to help prevent them from losing vision by preventing further damage to their optic nerve. Now, if for some reason the medications don't work or they have side effects or issues with taking them, we can progress to a more aggressive option such as laser procedures. The nice thing about lasers, they're in office, they're very low risk, very low side effect, and mostly they're covered by insurance. If for some reason the medications and laser surgeries don't work or they aren't the best option for the patient, we do have surgical options. And glaucoma is great. There's always new things out on the horizon. There's so much research being done. Every year, there are new surgical techniques and procedures coming out. The main kind of gold standard glaucoma procedures are tube shunts and trabeculectomies. But the nice thing is, we can treat patients way before they're ever a candidate for those sort of more invasive glaucoma procedures. We now have minimally invasive glaucoma procedures. And if you talk closely with your doctor, your glaucoma specialist, you can figure out what's the right option for you.